Joining us is State Health Officer Dr. Scott Harris. Dr. Harris, thank you for speaking with us.
Thank you for having me.
First, could you give us an update on our latest COVID-19 numbers?
Yes, Alabama has now seen more than 18,000 confirmed cases over the past 2.5 months or so. For the past several days, we've added around 500 new cases per day. We think some of that number could be accounted for by increased testing, but certainly not all of it. We certainly think that there is ongoing community transmission going on in several parts of the state, as well as several outbreaks or hotspots as well.
Where are we seeing those hot spots?
There are a number of cases. Right now, we've had long-term care facilities that have had outbreaks in Tuscaloosa County, also in Hale County and in Butler County. We have additionally seen outbreaks associated with the poultry processing industry, and those have occurred in places like Walker County and in Franklin County.
Okay, now how are we doing as far as flattening the curve?
Well, we feel like our hospital capacity has is doing pretty well. We certainly have had some surges in certain areas. Here in Montgomery, where I'm located, we know that our hospitals have been really at capacity for some time. They've been for the past week and a half or so. They have really been at about the edge of the capacity they can tolerate, although they are managing to do that. We've certainly seen higher numbers than we had seen previously in Tuscaloosa. And also still a fair number in the Mobile area. But overall, our statewide hospital capacity is doing fine.
How have loosened restrictions affected our state?
I think it's hard to know with certainty, but I think we certainly believe that as people get out in public and begin to interact more with other people, there's certainly a risk for increasing transmission. It's been about 3 weeks ago when we really ended our stay-at-home order, our shelter-in-place order, and I think since that time we have seen increased numbers. So again, it's hard to always to correlate that one-to-one, but I think the more that people are out and about, the more likely they are to be exposed to disease or to transmit that disease to other people.
Is that one of the concerns you have as we head into the summer season?
Yeah, I think that's true. You know, the hardest problem really is getting people to understand that they need to change behavior. And particularly as folks have been cooped up now for a few months and we've had all this anxiety and stress going on, people see that restrictions are being loosened and they just naturally want to assume that things are safe, that they're free to do whatever they want, and they associate in ways that make disease transmission more risky. So really now more than ever, we need people to understand that following the 6-foot distancing rule, that sanitation and hygiene, that face coverings or masks, those are really more important than ever as more people get out and about. We really need to protect our most vulnerable citizens, those people who are seniors or those people that have chronic health problems, because the more people who are out, the more people who are going to be at risk.
I'm switching gears a little here, but as we know, there are protests happening around Alabama, and people are participating in those protests in large groups. What do people need to keep in mind if they decide to participate in those protests?
Sure. For people who are participating in protests, just remember that being within 6 feet of another person can put you at risk of disease transmission if someone else is infected. Remember that somewhere between a quarter and a third of all people with COVID-19 don't have symptoms. So many people may be out not even realizing that they're infected and that they could be infectious to others. So it seems like a strange ask or a strange request for people that are involved in a big mass gathering, whether they're protesting or doing anything else. But we really need, especially those vulnerable people, those people like our seniors or those with chronic health problems, to either avoid those altogether if possible, or certainly if they're out, to make sure that they're wearing masks and face coverings, that they're staying at least 6 feet away from other people who are not from their own household, and to be very careful about sanitation and hygiene.
Okay, my last question for you, Dr. Harris. With sports activities being able to pick up again, what are your thoughts on those?
Well, I think the same rules apply. With more people getting together, there's more risk for disease transmission. We certainly understand the importance of sports to so many people in our state. And as you know, for the past couple of weeks, sports teams have been able to do training activities and practice activities, and we've encouraged them to try to maintain distancing as much as possible. Starting on June 15th, actual competition is allowed to resume. We certainly understand that just the logistics of sports don't allow for people to always stay 6 feet apart or to wear masks or to do any of those things. But to the degree possible, we would want people to try to do that. Certainly that would apply to folks standing on the sidelines or in the dugout. We would want that to apply to people who are in the stands. We just want people to try to be as safe as possible. We really have to try to protect our most vulnerable citizens any way that we can.
State Health Officer Dr. Scott Harris, thank you for joining us.
Thank you for having me.